Welcome back. This Live Healthy segment is sponsored by Metro Health. On average, someone in America dies of a stroke every 4 minutes. It's also a leading cause of serious long-term disability. And that's why it is so important to know the warning signs and get the proper care quickly. Dr. Jordan Taylor joins us today. He is a neurologist at Metro Health and part of their team on the cutting edge of stroke care. Good morning.
Good morning.
It's good to have you here. What is a stroke? What does it do to our body when we have a stroke?
Sure. Well, a stroke is a very general term that we use to describe a couple of different situations. The main situation, which is about 85% of strokes, is where you have a blocked blood vessel to the brain. That can happen from a variety of different reasons. The end result of that is that you lose some of the functioning in that area of the brain. The second least, or the less common type of stroke is where you have bleeding into the brain. That accounts for about 15%, and that's usually a leaky blood vessel, an aneurysm, or something along those lines.
I have always heard that responding quickly is key, so you have to know the warning signs. And we have a little graphic that we're going to put up, and you're going to talk us through knowing what to watch for.
Okay.
So it's called FAST, right?
It is called, yeah, we try and make it easy because really there are so many different ways that stroke can prevent. The main ones people should really be aware of are F, which stands for face, so you're looking for a facial droop on one side. Then there is A, which is arm weakness, and you're asking somebody basically to hold their arms out and see if one side is weak or not. Then there is S, which is speech. So when you're speaking to somebody, have they developed a new onset of slurring of their speech or inability to talk? And then that last one, T, isn't really a sign of stroke. That's the big reminder that you need to call 911 fast. Time is really of the essence. Every minute that you wait, you're losing millions of neurons.
So you guys have this world-class response when people are brought into your ER. Tell me a little bit about what it happens immediately.
So the minute you walk in the door, we take it very seriously because, again, every minute counts. From the moment you walk in, you're really integrated right into the stroke team. You're seeing an emergency room physician, the nursing staff getting your blood drawn right to the CAT scan machine. You'll see a neurologist, and if appropriate, you get stroke treatment, which is a type of blood thinning medication.
Is that the only thing you do? And then you just ride it out, so to speak?
Sure. Well, there are a couple of different options right now, but the standard of care at this time is blood thinning medication. It's called TPA, and we really try and administer that within an hour of coming to the emergency room. But really, we push for every minute faster than that. And then there are a few backup options as well, some direct procedures which can be performed, and those are there in case the TPA doesn't work.
And literally, moments count, right? I mean, you cannot even stress that enough.
Yep, every minute counts. I was telling somebody from Metro that I live about 8 minutes from the hospital, and if I get called, that matters. You know, every second matters, and so we get in, we get things started. Every other month, we have a sit down and review things to make sure we are not missing a minute on anybody.
And then you guys are also committed to the follow-up and the follow-through after, right?
Absolutely. And that follow-up starts the minute you're admitted to the hospital. You know, are there some lifestyle changes that should happen? Do you need medication changes? Will you be able to eat the same food? And then what are your physical needs? Do you need physical therapy? Do you need occupational therapy, speech therapy, all these different things? And that starts right in the hospital, and then we make sure you get onto the right place. We've got great partnerships with Mary Free Bed and other outpatient facilities, and so, you know, getting that rehab and getting you on the road to wellness.
And it could be a long road. What can we do to prevent?
Yeah, so really a lot of the focus has taken place into what we call secondary prevention. You have a stroke, so what do you do next? But it's really the same sorts of things that you would do if you had wanted to avoid it in the first place. And so I think the thing I tell people, your best bang for your buck is to look at your blood pressure and work with your high blood pressure with your doctor. Outside of that, you've got your cholesterol. Are you a smoker? You know, how active are you? All those sorts of factors are all very important for preventing a stroke.
All right. Well, May is Stroke Awareness Month, so it is a great time to join Metro Health for a free seminar on prevention and treatment. They are having the seminar on Monday, May 18th. It's from 6:30 to 7:30 p.m. in the Metro Health Conference Center next to the hospital. You can learn more and register online at metrohealth.net. Click on classes and events. We've put all the details on our website at WZZM13.com under Take 5. Thanks for being here, Doctor.
Thank you very much.
Good to have you.